So Nick has introduced me, so I don't need any. The micro. Yes, good point. Because I'm very, very small, as you know. So after Nick, for instance, it makes a huge difference. Okay. So I'll try to share my personal story. It's not a universal example, but it may indicate some problems you can have while being in a watch and wait period. I was diagnosed in 2011 after a global health check. Well, it was a routine check. No, I am lucky enough to, in the meantime, no other symptom, no treatment, so I am typically watch and wait. The only thing I have is one blood sample twice a year and one abdominal ecography every 2 years. So it's not very, very difficult to support. Well, of course, the way the disease is announced was for me also an important moment. It's a very sensitive moment for most of the patients and their relatives, as well as for the clinician, I expect. Well, back to the word cancer, associated with, or not, with good. For me, it was the case. It was a good cancer. I was told it was a good cancer, no question. And well, it may, of course, produce shocks by the people. And I think it's quite important for the patient and for the environment of the patient to well understand the disease. As you know, it's not a simple disease. It's a lot of different types of CLL. And it's important to know about the consequences and the treatment perspective. And therefore, I think the patient advocates, the association, must play an important role. It may be difficult for those associations to reach the watch and wait patients, because if there is a treatment, you have very often visits to the clinicians, etc. If you are in watch and wait, it's twice a year, it's once a year. So the opportunity for the association to reach the patient is a little bit difficult, but I guess that, for instance, at least for the youngest patients, the positioning of the association with internet sites, in social networks, it's key, because sooner or later you will have questions and try to answer the question through the social network. So for the association, I think to be present in the social networks is absolutely key to reach also the watch and wait patients. Because, for instance, in France, we have a lot of regional meetings with clinicians, with nurses, with patients. And most of the patients are patients who have been already treated. Watch and wait patients are the minority. But it would be necessary to get the watch and wait patients in those regional meetings as well, to have the opportunity to inform them, because for me it's absolutely key. In my case, to some extent, I was aware, very partially, but I was aware of this disease because my father suffered from this disease decades ago. Well, it was a period where, of course, the treatments are quite different. It was only chlorambucil, and well, he survived almost 20 years with chlorambucil, and it was not bad, but I think it would have been better today, of course. Well, the information provided by the hematologist for me was extremely succinct. You most probably won't die from CLL. That's what you said, Brian. And it was in my case. I changed the hematologist in the meantime. But okay, well. And the information that I got the most relevant information that I got was from the Silk Association, meaning the French association dealing with information and support for CLL patients. It's the sole association in this case in France, and it is very active, and I think for me it was absolutely key, and that's the way I had to get all the necessary information. Well, the precaution, of course, to be taken as a watch and wait without symptom, without treatment, is avoiding or treating any infection, being regularly vaccinated against influenza and some pneumothies. It's nothing, but it's important. And, of course, checking regularly the clinical picture by an hematologist, because I heard that at the beginning, some are not, you said that, Nick, you were not treated at the very beginning, treated by a hematologist. So it's important to be in front of experimented clinicians, of course. To be or not to be sick, for me, it's a main question. As long as you are in a watch and wait period. Of course, you can't forget you are a CLL patient. At least I think you shouldn't forget it. But you may also have heard about the 3/3 rules. I'm not sure that the 3/3 are equally important, but okay, let's say, roughly speaking, 1/3 will never be treated, 1/3 will evaluate slowly, 1/3 will evaluate rapidly. Well, you cannot know in what category you are, because there is a lot of different situations and a lot of different kind of CLL, as you know. And how to behave in front of the disease. For me, of course, at the end, it's obviously a question of personal psychology. My colleague of MPN mentioned the two categories of patients. I think she is absolutely right. I have the feeling I am in the second one. But I try to consider that I can live a normal life as long as the disease doesn't need to be treated. Maybe I am too optimistic, but the rule I have. But of course, at least twice a year by the blood sample, I have to wait until I get the result of the blood test, which recalls me that I am a patient who could sooner or later enter in heavy treatments. So it's a normal life, but with some very important rendezvous that are not that pleasant. Sometimes my relatives or friends are looking more concerned than I am, which, well, for me it's rather a good signal. But I must precise and tell you, as I told my friends, for instance, that I was active as a patient advocate, they said to me, "Well, why are you doing so? You are not treated. You are waiting and watching, or watching and waiting, and it will recall you that you are sick, etc., etc." It's absolutely a wrong appreciation. I think you can live a normal life, but not without having consciousness of what the disease is all about and what the perspective of the disease may become. So I think key point is keeping well informed, of course, about everything that refers to the disease, be it treatment, side effects, statistics, etc. And of course, that's the role also of the patient advocates, and that's the reason why I am a member of this community. How does the future looks like, especially for the watch and wait population? I think that the most important, for me at least, it's the most promising thing is the very great perspective brought by the new therapies. We have some very amazing examples, for instance, with Brian, who is living some kind of resurrection. So, of course, new therapies, provided they are available, which is unfortunately not the case in many countries. And that's why I am also very, very pleased to see that there is a lot of different countries in this audience. And we are keen to get information from you. What are the problems you are facing in your countries? Jana told us a little bit about the Czech situation in her introduction, and that was quite relevant and interesting. I think it's important to talk about it because, I mean, the best practice should be shared, and it is a mean of pressure in front of the health authorities or every kind of players in this field. Well, of course, every year new molecules, combination of techniques are tested and launched, combination of new therapies, CAR T cells and whatever. However, whether we can already consider that GLL-CALMI cures is still open. We had some interesting presentation today. Well, I think nobody is able to say it will be cured, but of course we are progressing, and compared to the situation 10 or even 5 years ago, there is a lot of hope provided. And it increases with the time, which is for sure an optimistic point of view, but a realistic point of view as well. So every year gained is a promise. That's my philosophy. And that's the reason why my conclusion would be watch and wait as long as possible. Of course, it depends on many factors, but it's important. And above all, rely upon the patient's advocates for easy to get, reliable, and up-to-date information. Thank you very much.